Welcome to the American Academy of Grief Counseling, and today's video, play therapy and grieving children. And in this video, we're going to discuss the purposes and benefits of play therapy for grieving children. Unfortunately, children are victims of war, abuse, trauma, and loss. And because of that, children grieve, but they grieve differently because they're not as developed as an adult. They lack maybe particular social skills. So as much as we want to wish that children were not victims of these types of things in life, the unfortunate reality is they are. And we have to be able to help them. So because children are more right brain developed, and also less socially developed, many of the feelings and traumas associated with abuse, loss, or in cases of war, are associated more in the area of the brain that is not able to express in a more concrete way. Instead, these experiences in the right brain are associated and experienced in the lower areas of the brain. The amygdala, the hippocampus, and the thalamus are non-verbal areas of the brain with children. So if we hope to be able to communicate and discuss trauma and pain with children, we have to be able to do so more than not in a non-verbal ways. And this is where play therapy comes into the picture. Play therapy helps children express in a nonverbal way what they're not able to communicate. So grief counselors and child specialists will utilize a variety of play therapies to help children communicate. Now, again, I want to emphasize, if you are a certified grief counselor, that is fine. But if you're working in pathology or working as a child specialist, usually you also need to be a licensed professional counselor. And in most cases, licensed professional counselors who are also grief counselors also have special certifications in play therapy so that they become specialists in it and are able to utilize it to its best. Now, play therapy itself owes its origins to Herman Hug Helmuth, who in 1921 first introduced the ideas of allowing children to express their sorrow, pains, emotions through toys and other games. Melanie Klein as well was a pioneer in the field, and she discovered a doorway into a child's subconscious mind is through play. Again, later in 1938, David Levy would utilize toys and other objects chosen by the child as a way to identify past trauma and relive traumatic events via play. And this became known under Levy as release therapy. Joseph Solomon also employed active play as a way to allow children to express emotions such as fear and anger in a controlled way to help them become more able to interact later socially. So that's a little bit of a history on play therapy. Other than that, when we see children trying to express trauma or grief, we tend to see a lot of tension, fidgeting, repetitive movements, aggression, self-harm in some cases, low energy, increased heart rate, hyperactivity, somatic pains, rapid breathing. And these are all things that can be from one end of the spectrum to another in regards to a child who is in distress. Alan Wolfert points out that helping children grieve is not just about therapy, but it is a companion experience that involves actively participating in the child's healing process. And play therapy involves actively entering into the child's world, earning the child's trust through a series of meetings, creating a safe place where the child feels comfortable to express him or herself, and a way during that play to translate their expressions. During play therapy, the counselor wants to give the child controlled, that's key, controlled freedom. So it's still a presentation of what needs to be done, but the child is giving options to show that the child has some semblance of autonomy. So the child in himself or herself is allowed to choose the toys in the room or the games that he or she wishes to play. The counselor does not look to push serious questions, and instead observes and plays with the child, usually sitting at eye level with the child. And the counselor will usually talk about the toys or games a child likes to play. Many times, the counselor will use a reflection method of repeating what the child says and encourages the child to name the toys and to express how each toy makes the child feel. So it's a very rigorous uh, and direct process by the counselor, where the counselor has a goal and the counselor is very focused, but the counselor is also very patient just to see the various breadcrumbs that are laid out by the child for the counselor to have a better understanding of what is bothering. Now, there are a variety of ways children like to play, and there are a variety of ways that certain toys can bring out certain communications from the particular child, and the child might release past trauma or how they feel about a certain situation. So figurines, stuffed animals, and dolls can help children react trauma. The children will actually play with these particular action figures or dolls, and sometimes will reenact what has occurred to them or what they might have witnessed. Puppets are a good use. They help children talk and express themselves and allows them to talk through the puppet. Art, drawing, clay, painting, building, and Legos are all games that help the child express creativity and draw and express feelings from within as they are doing it. And a lot of things that children put on paper or create reflects what is going on inside their minds. Balls and sporting toys allow the children to feel at ease and expel energy and emotion through activity. Music and singing can relate and ease the child and help the child express emotion through song. So ultimately, the key through these toys or tools is to help the child tell his or her story, to find healing, and to discover other ways to find outlets and creative ways to express and rediscover oneself through these plays. Now, we all know with grief itself, if grief and trauma is not focused on at a younger age, it can later emerge later in adulthood. So it is essential that play therapy bring out over time, patiently, but bring out what is there and help that child face that trauma and heal properly. We here at AIHCP offer a grief counseling certification, the link's below. We also, for those who are already certified in grief counseling, we offer a child and adolescent grief counseling certification. Again, for those who work in the more higher clinical fields, well, you're going to have to also be a licensed counselor or a licensed social worker or a psychologist or psychiatrist really to take play therapy to another level. But these certifications are definitely important for those who work in pastoral fields, also for those who work in clinical fields. Our number here is 330-652-7776, and our email is info@aihcp.org. Also, don't forget to subscribe to our YouTube channel at AIHCP, where you'll find many videos like this or similar regarding behavioral health or healthcare itself. I'd like to thank you for listening and have a good day.